Hello and welcome. The human brain is it's the most complex thing we know of, right? A whole universe of thought and memory tucked away inside our skulls. Today, we're going to dive into what happens when those very processes, the ones that make us who we are, start to change. So, at the very heart of all that is something we call cognition. It's the silent, nonstop work our brain is doing every single second. Seeing the world, hearing it, making memories, making judgments, connecting the dots. This system is literally how we experience reality. So that brings us to the big question, right? What happens when that incredibly intricate system gets thrown off course? When memory starts to fail, or your very perception of the world begins to, shift? And that's where we start to talk about cognitive disorders. All right, so when we use the term cognitive disorders, we're not talking about that everyday forgetfulness, like, oh, where did I put my keys again? No, we're talking about something way more significant. A cognitive disorder is officially diagnosed when there's a major, and I mean major, shift from how a person used to think and function to the point that it really impacts their quality of life. And yeah, these things can pop up at any age, but they're most often tied to the neurobiological changes that happen as we get older, which is why we're hearing about them more and more as our population ages. Okay, so let's jump right in and clear something up that gets a lot of people confused. The two main paths of cognitive decline. The difference between them is huge. Think of it like a sudden, violent thunderstorm versus a slow, creeping tide. And this chart here, it really lays out that storm versus tide idea perfectly. Delirium is the thunderstorm. It hits fast, it's often caused by something temporary, like an infection or a reaction to a medication, and it's usually short-term. Dementia, on the other hand, is that slow tide. It comes in gradually, over months or even years, it's a chronic condition, and it's caused by a progressive disease. And this quote, it's a great little window into what this actually sounds like. With dementia, someone might start to make up stories to fill in the blanks in their memory. That's a fascinating thing called confabulation. Or they'll just struggle to find the right word. But someone with delirium? Their speech is much more likely to be all over the place, totally incoherent, maybe even loud. Okay, so dementia itself is a really broad umbrella term. Let's narrow our focus and unpack the most common cause of dementia, a disease that I think most of us have heard of, but maybe don't fully get: Alzheimer's disease. And just to get a sense of the scale here, more than 5.7 million people in the US alone are living with Alzheimer's. It's so easy for that to just sound like a statistic, but that's millions of individuals, millions of families, and circles of friends whose lives are just completely turned upside down by this. Now, we still don't have the exact cause, and there's no cure yet, but researchers have pinpointed some key risk factors. Age is the big one, but things like family history, your genetics, your ethnicity, and even your history with head injuries or heart problems, they all seem to play a role. And these factors lead to a disease that, sadly, unfolds in a pretty predictable pattern. So let's walk through how this disease typically progresses. In the mild stage, the first thing to really go is short-term memory, the ability to make new memories. It's not just about forgetting a name. It's like the brain's ability to record the events of today just stops working. And from there, you see difficulty with planning, you see personality changes, and a tendency to pull back from social life. Then, as things move into the moderate stage, the person is often painfully aware that their abilities are slipping, and they might make up those stories we talked about to cover for it. The memory loss gets so bad that simple tasks need repeated instructions. The world becomes a confusing place, which, as you can imagine, leads to wandering, a lot of fear, and sometimes outbursts of anger. This is the point where constant care becomes absolutely necessary. And then there's the severe final stage. Here, the disease has moved beyond memory and is attacking the brain's most basic commands: the ability to speak, to walk, even to recognize the faces of your own family. It's gone. Eventually, the body's core systems start to fail, which leads to fatal complications. It's a complete and tragic loss of the person they once were, long before their life actually ends. All right, I want to switch gears for a minute because it's so important to understand that not all conditions that affect the mind are about memory loss in this way. Let's talk about schizophrenia, which is a fundamentally different kind of challenge. It's a thought disorder. This is one of the most important things to get your head around when it comes to schizophrenia: the idea of positive and negative symptoms. Now, positive does not mean good. Think of it this way. Positive symptoms are things that are added to a person's reality, like hearing voices or having delusions. Negative symptoms are abilities that are lost or taken away, like motivation or the ability to show emotion. And this visual really helps put it all together. You can see the different categories, the positive symptoms like delusions, the negative ones like a loss of interest or motivation, and even cognitive symptoms like memory problems. All of them together just profoundly change a person's life. So the key thing to remember here is that schizophrenia isn't like dementia. It's a thought disorder, and it usually appears much earlier in life, often showing up between the ages of 15 and 25, and it affects about 3.5 million Americans. So whether we're talking about dementia or schizophrenia, there's a huge challenge they both share: treatment. It's almost always this really difficult balancing act between controlling the symptoms and managing the side effects of the medication. Take schizophrenia, for example. The antipsychotic drugs we have now can be life-changing. I mean, they can be incredibly effective at stopping those positive symptoms like hallucinations and can literally give someone their mind back. But, and it's a huge but, they can come with some really severe side effects, forcing this tough choice between a distorted reality and a physically challenging one. And this is what we're talking about. They're called extrapyramidal side effects, really distressing, involuntary muscle movements. They can range from something called akathisia, which is this intense inner restlessness, like an itch you can never ever scratch, but all over your body, to acute dystonia, which is these painful, twisting muscle spasms. For doctors and patients, it's a constant negotiation between the medicine's benefit and the burden of these side effects. So at the end of the day, whether it's the slow fading light of Alzheimer's or the altered reality of schizophrenia, these are deeply human conditions. They affect millions of people who are just trying to find their way through a world that can suddenly feel confusing and terrifying. Look, understanding the clinical side of things is so important, but it's really just the first step. The real question for all of us is, how do we take that knowledge and use it to build a more supportive, more compassionate world for them and for the families who love them?